Hello, everyone. I'd like to thank you for your time and your commitment to this opportunity in order to learn more about depression in cardiovascular disease patients. The goals of these video modules are to help you learn more about patient depression, its risk factors, and also treatment options and screening tools. It's also here to help you review the impacts that depression has specifically on cardiovascular disease patients. Now we look specifically at depression. Depression is a mood disorder. It's a common psychiatric problem within the general population, and it has a prevalence rate of 7.1% of adults at any given time in their life. They may suffer from occasional depression. It doesn't matter which age, it can happen at any time. It is the most common mental health condition for patients seen in the primary care setting. The Diagnostic and Statistical Manual of Mental Disorders, the fifth edition, or the DSM-5, it defines depression or major depression syndrome as an episode that lasts most of the day, nearly every day, for a minimum of 2 weeks, and it includes some of the following symptoms: depressed mood, loss of pleasure or interest in all activities or things that they used to enjoy, insomnia or hypersomnia or lots of sleeping, a change in appetite or uh, high changes in weight, different psychomotor agitation, decreased energy, poor concentration, thoughts of worthlessness or guilt, and recurrent thoughts about death or suicide. Looking at specific risk factors for depression, it includes previous episodes of depression, a family history of depression, female gender, so going through stressful life events, lower income populations, people who have poor social support, and those who go through some serious medical illness such as physical handicaps, chronic kidney disease, heart disease, and then substance use and dementia. While the presentation and the course of depression may not be constant or consistent person to person, 72% of individuals who suffer from one episode of depression frequently have recurrences of the same problem. So now we look at what is the correlation between depression and cardiovascular disease. So cardiovascular disease is still one of the leading causes of death in the population of the United States. It includes several different official diagnoses, such as coronary artery disease, heart failure, strokes, heart dysrhythmias. And among these groups of diseases, depression can have a prevalence rate as high as 60%. Again, in certain groups of these diseases, such as heart failure, and that's in comparison to the general rate of depression in adults, which is 7.1%. Now, there have been multiple studies to understand more about the physiological and psychological tendencies that correlate depression and cardiovascular disease, and there have been links made through several components, such as autonomic dysfunction, increased platelet activity, insulin resistance, chronic inflammation, and neuroendocrine imbalances. One such correlated example is broken down here, showing in this image, showing depression as a concurrent contributing factor in the development of coronary atherosclerosis. To address these higher rates of depression recognized in cardiovascular disease patients, the American Heart Association implemented depression screening as a guideline of care for cardiovascular disease patients or heart disease patients. And this change was introduced into guidelines in 2008 and has been debated either way, whether it should be implemented or not be implemented by different professionals. In an ambulatory setting or in a primary healthcare setting, this is a consistent task that is completed, depression screening. Unfortunately, 28% of men and 17% of women do not have a primary care doctor or have not seen a primary care doctor in over 5 years. So that's a gap in one of the issues surrounding depression and screening. Another gap in current screening recommendations is that there is no acute inpatient um, guidelines, such as for ACVU, where depression screening is not an integrated part of protocol. But that does not stop you as a caregiver deeming it necessary to screen for components of depression in your patients. To touch briefly on treatment options for depression, on ACVU, the most identified and commonly used is different pharmacotherapy, different medications of several different classes. I've listed them down here. There are SSRIs, SNRIs, atypical antidepressants, and so on. There's also different alternative methods of treatment for depression, and it's mostly associated with Eastern medicine. There can be different chakras and things like meditation, but also there's behavioral therapy um, that involves, talking through your mental health and being able to work through it in that way is also commonly used for the treatment of depression. So now we look at specifically are the impacts of depression on patients. Many of us have seen the results of depression in our patients, even if we have not fully realized it. Um, Frequently, it manifests such as a decreased ability for patients to adhere to their plan of care, whether that be medication adherence, lifestyle modifications such as diet and exercise, and ultimately, impacts like these can result in what's called long and short-term adverse events. And this can be an additional comorbidity, such as the development of heart failure after an acute MI, or things like readmission to the hospital, or even death. These are what have been noted as to be short-term and long-term events for depression among cardiovascular disease patients. So this concludes the first video talking about things associated with depression and learning more about depression and our knowledge. At the end of each video segment, I want to present some mastery questions or some case studies for us to be able to review what we've learned in the video, and also kind of look at specifically a scenario that may be applicable to your work environment. So here's the mastery question. Go ahead and complete it, and be sure to pause the video if you need some more time. Thank you, and we'll see you in the next video.